Hello, honorable people. Welcome back to Interview with Experts segment on healthy living with Bofa Show. Thank you so much for joining our broadcast. God bless you all. Our discussion today focuses on food insecurity and poor nutrition. We want to talk about this because they are threats to our health. They are a threat to our health because food insecurity can result in diminished nutritional quality of food eaten by both adults and children in households, leading to poor nutrition, lower than necessary intake of essential nutrients such as protein, vitamins, and minerals, and higher than needed intake of high energy, low nutrient dense foods. If the food supply is not adequate or stable, food insecure individuals may report distorted eating patterns where people do not eat as frequently or reduce quantity. And our guest on the show today is a medical doctor, a public health physician, and a medical epidemiologist. Over 20 years of experience directing and overseeing international development and global health projects in health. Again, our focus today is on food insecurity and poor nutrition. But before we get started, let's quickly take a break. And when we return, the show begins. Let's take a break. I'll be right back. All right, welcome back, viewers. This is Interview with Experts on Bcos TV. If you're just joining us, thank you so much for watching. We are discussing today about food insecurity and poor nutrition. Of course, everyone should know by now that food insecurity and poor nutrition are threats to humans' health in our community. Just like I mentioned before the break, we have on the show today an expert from public health. He is a public health physician and epidemiologist, Dr. Henry Ayuk. Dr. Henry obtained Bachelor's of Medicine from University of Ibadan, a Master's of Science in Public Health from University of Calabar, and another Master's in Epidemiology from University of Ibadan. And finally, bridged his PhD in Development and Global Health Sociology in Primary Healthcare from University of Calabar. Dr. Henry Ayuk is the chairman and the CEO of Ayuk Hospital, located in Abuja and Port Harcourt, Nigeria. Welcome on the show, Dr. Ayuk. Thank you so much for joining us, sir. Thank you so much for being part of those that really care for people's health out there. Thank you so much. Now, let's get started with public health. And I'm sure this is one of the area of your specialization. Let's get acquainted with this service. You see, doctor, in all the continents, in Asia, Africa, Europe, North America, South America, Australia, all the continents, there is an agency called Public Health Authority. This agency claims to be responsible for, of course, public health, emergency preparedness, and responses. Can you please tell us the significance of public health and why public health is important? Please tell us the purpose of having this agency.
Well, thank you very much. Public health, as you've rightly mentioned, deals with population health. This is different from medical practice, for instance, which like hospital care that addresses individual health, personal health. For public health, we deal with clusters, population. So the indicators are not actually the same. Whereas, whereas in medicine, you are dealing directly with medical conditions that have come. In public health, our attention is directed towards preventing those things that will make somebody to go to the hospital. So more or less, public health has its significance in ensuring that the causes of disease that are usually prevalent in the population, in the communities, are prevented. The exposure to disease is prevented so that people don't have to fall sick. So public health emphasizes promotion of health. It deals with interventions that prevent the emergence of disease. So that is why it's important that public health should be the trend. Instead of waiting for people to fall sick and rush them to hospitals, in public health, we try to prevent the emergence and try to reduce, even if the disease emerge, we try to reduce the danger. I mean, the severity of the disease is also.
Wow. Thank you so much, doctor. We understand that epidemic is when a virus, disease, or infection spread within a community, state, or country. While pandemic is when it spread across the country or to another country. When does public health authority act on an outbreak event? Is it when a disease or virus or infection becomes an outbreak, epidemic, or pandemic? When exactly do they have to act when this happens?
Yes, thank you very much. Pandemic is an epidemic. It is not that there is no, it's just a matter of definition. Pandemic is on a larger scale, involves larger clusters. Epidemic is more localized, but all of them are, both of them are epidemics. So pandemic is just another term for a larger epidemic.
Outbreak.
Yes. Now, so and what is an epidemic? Once the disease level or the occurrence of disease or an infection is above the normal level, even if it's one case, one event, that case becomes epidemic. For instance, the world has been freed of, say, smallpox. If suddenly you have just one incident diagnosed, that is an epidemic. So it's not in terms of the number of people that fall, I mean the number of cases, but the number that is above that which is accepted as normal. So if you have an occurrence of disease where, for instance, in Nigeria now, in Ebonyi State, there is the occurrence of monkeypox. That is a disease that occurs among monkeys. So even if you discover one among human beings, it is an epidemic. And the larger the involvement of more and more communities and countries pushes it to become epidemic. So yes, coming to your question, when do you notify? Once an epidemic occurs, it doesn't matter whether it's pandemic or once it has occurred. Once the case has been identified and it ought not to be there and is there, then that is an outbreak that should be notified. And if once there's a notification, then there is a response. The response is in terms of putting the necessary infrastructure to ensure that that case or the epidemic is curtailed as soon and as quickly as possible.
So it doesn't matter whether number increase, it has to be immediately, notified by the people that have the, infection first. Even if it is one person, they need to be notified before they can take action, right?
Of course, it needs to be notified before it needs to be notified, because it is one thing to report and a case is reported, a clinical diagnosis is made, but then you have to confirm that it is that clinical condition before you can say there is an epidemic. If somebody says there is cholera in a particular community, we have to collect a specimen and send to the public health laboratory and diagnose it to be so before you can say it is a case. So many cases, many medical conditions have similar symptoms and signs. So it is important for us to take note, apart from the history that you've collected, the information, the travel, how the incident case came around, how the condition was reported. We need to address it by diagnosing and confirming that it is that case in question before you can roll out any definitive interventions.
Thank you so much, Doctor. Now, Doctor, there are many practices under public health nutrition, because I want us to go to nutrition now, such as food nutrition, advocacy and education, research and evaluation, policy, system and environmental change, and more. But I'm going to focus on policy, system, and environmental change. And I want us to talk about the need assessments in this particular practice, that is policy, system, and environmental change. Of course, you and I know that there is nothing like public health nutrition services of community based in Nigeria right now as we speak. Now, I want us to talk about it. How do we create or establish public health nutrition services of community based and services areas in order to identify gaps in services, that is the need for assessment, and also contribute to coordinated program or intervention planning that supports collective impacts and sustainability of services across the sector? How do we create these public health nutrition services of community base?
Well, in all situations, in public health, conditions are addressed almost similarly. We need to emphasize that community diagnosis and management of a condition is not the same as hospital. For instance, in nutritional, public health nutrition, before you can say a community has adequate nutrition, for instance, you are looking at three basic things. You are looking at, you are assessing the status of access to food security in the home, in the household. That is number one. I think you must bear in mind to say, okay, nutritional, there is a problem with nutrition. So you must assess, number one, the access, adequacy in the access of, in assessing food security by households. Then the second thing is adequacy of health services, because public health nutrition is a web. There are a lot of things that contribute to, you can't just say, you can't just define public health nutrition in isolation. You must identify whether or not we have adequate health services provided in that community. Otherwise, doing nutrition in isolation will give you nothing. Then the third thing is to be able to look at the vulnerable group and assess how much care they are receiving in that community. And what I'm talking about, vulnerable group that are vulnerable to nutritional disorders are the women of childbearing age and children, under 5 children. So these three things must be assessed. These conditions must be assessed. They are the framework, they are the foundation of every nutritional. Unfortunately, we don't have that that arrangement on ground in Nigeria. So there is a whole what we need in Nigeria is probably to establish community-based nutrition nutritional services. And how do we go about that? Since we don't have it now, probably we start with pilots. And in pilot, we do a needs assessment, particularly addressing what I've mentioned earlier, those three basic areas. First, food security. You choose a community for the pilot, and then establish those find out exactly how much food security is available at homes, find out the health services that are located in that community, and then the care that is, the importance that is given to pregnant, to women, and then children. Once that has been assessed, then we can roll out the service delivery component, the implementation of nutritional services. And that is what you have tried to align in asking the program, trying to find out exactly policy development, what do we do to address this gap in terms of food, food security. Do we have enough service centers in which we can link up with services? Link up children and so forth that have one problem or the other. Then we start looking at those things. We have monitoring and evaluation of what we are doing. I've mentioned linkages. You can also look at research to find out exactly if there are innovations which you may bring in a particular. That is how the basic approach for community community-based nutritional.
Yeah,
but
public
like
and nutrition community-based.
We don't have a defined structure like that yet in the country. So if we must start it, probably we start it with a superstructure, see the availability of supportive services at the same Ministry of Health in the state, look at the communities, see the kind of whether we have agencies or community-based organizations, volunteers that will be able to support this service delivery. But like I said, we must begin first and foremost with a pilot, and a pilot in different locations, and then come out and analyze the outcomes. Then from there, probably we can move forward.
And serve the public. Wow, thank you so much, sir. Now, under public health nutrition, I want us to address food insecurity and poor nutrition. You mentioned it in your response now. Because I bring this issue because public health providers across the nation today, in this the world we have today, from individual physicians to community clinics and hospitals, they realize that treating food insecurity and poor nutrition as a health issue can lead to better health outcomes for people, improvements in community health, and cost savings as well. Because they realize that this is a threat to community health. Increasingly, they are now addressing the issue, food insecurity and poor nutrition, not only among their own patients, but more broadly as a part of their community benefits. As programs to promote population health in the communities where they are located. The question is now, how can we reduce food insecurity and poor nutrition to promote population health in the communities where the individuals are located?
You see, the problem we have with nutrition in Nigeria is ecological. What do I mean by ecological? The environment, essentially the factors that are located within the environment. Of course, poverty, is critical, but poverty is not enough to define food insecurity, because there are a lot of people who are rich, wealthy homes that don't spend as much and don't allow any reasonable income to be spent on food.
That's true.
So it's not,
I agree with you.
It's not about it's not just about poverty, and that's what I said. Ecology, the ecology of the environment. The environment will promote the socio-economic factors that are available, poverty, educational level, and so forth, employment, and things like that are important socio-economic factors. But you see, in Nigeria, the most important environmental factor now, ecological factor, is insecurity in the country. You have herdsmen in the north herdsmen, we have Boko Haram, now we have bandits. People are no longer going to their farms. So you then down south in the east, we have the unknown men, unknown gunmen that are all over IPOP and so forth in Nigeria. So you find out that they have made even agriculture, the basic agricultural practice, unsafe. So you go to their farm and you are kidnapped. You go to your farm and you are killed. So people now are staying away. Even in Benue State, that used to be the food basket of the state. Today, in fact, there's a massive reduction in food being produced. Things are becoming very costly down south.
Exactly, because the production has reduced.
Yeah. Wow. So you see, basically, that's what I'm saying. If we must address food security in Nigeria, it's not what our vice president, for instance, was talking about, food that is being given to 1 million young children. That is a relief measure. That doesn't address food security. Food security, you must go to the root. Look at how you can improve the security of the country, restore farmlands, encourage farmers to go back to their farms, and ensure enough education. People are spending a significant amount of money on food for their homes, and not to keep money to buy cars and buy all kinds of houses and so forth. So it is important. There's a complete a new orientation about what kind of food should be taken at homes and what quantity of your capital should be spent on food. We should also address, remove security, take security issues very seriously, improve employment of people, and then ensure that we have adequate, when we have, like I said earlier, that you cannot address human nutrition, food nutrition, food and nutritional services without addressing health services. The core vulnerable groups today in our country that have the issue, that are most affected by problems of nutrition, have to do with pregnant women with anemia, nutritional anemia, children under 5 that are suffering from protein energy, malnutrition. You have lactational problems and so forth. So if we must be able to address food security adequately and ensure that it is actually meeting its objectives, then we must also ensure that adequate health services are provided, particularly for the vulnerable group, pregnant women, children, and so forth. So that is what I think should be.
Wow.
Yeah.
Wow. Now, you mentioned that before we can address food insecurity, we must first of all take care of insecurity in Nigeria. Why? Because this affects the farmers. They couldn't go to the farm to produce. And once there is no production of food, there will be high costs of that food out there, or we don't even have it at all for people to buy. So that means we must first of all address the insecurity before we can now talk about food insecurity. Now, let's assume that these two have been taken care of. What are the guidelines and methods to assess and interpret individual and community level nutritional status to determine priority nutritional needs of target populations across the life course?
Now, I have told you that earlier that for you to identify adequate nutrition, three issues have to be measured. Three basic measurements must be addressed. And if you are addressing them, it means that you are also developing guidelines. You are developing targets. You are developing guidelines to see. Number one, like I said, is you must assess the food security in homes, in households. Food security in households. You must develop indicators, guidelines, indicators that will measure what is the level of food security. Is this particular home having consistent and adequate food supply? Do we have that? It's not just the wholesomeness of eating, probably end up eating carbohydrates alone without vitamins and things like that.
Without protein, without fat.
Yeah. So you must assess that. Once you have assessed that, then you must now develop guidelines in which would help you implement such findings. I mean, implement here to prevent. I mean, to address those findings that you have found. Now, so guidelines must be developed. There's no way in which you implement a public health project without guidelines. And what are guidelines? There are policy on how you can manage a case. If it's a clinical case, you must be able to, that is a clinical case, you must be able to practically say, okay, I want to measure the body mass, the weight, and so forth. Want to measure some muscle size, those are hospital-based. But for us in community nutrition, we're looking at what quantity of food is available to a community, to a household. Is it adequate? Does it contain the various kind of food components? If they fall below a particular percentage, then we'll classify them as food insecure. Then that is one. And I don't think we have those guidelines for now because I've not seen any.
I don't, doctor. I'm sorry to cut you short because I was privileged to be one of the attendants when the first lady, Hajia Buhari, have an initiative that got to do with nutrition. It was a virtual program which the VP was addressing the issue of nutrition. I was forced to record all he said that very day because I do the math. I was listening to my vice president Oshibanjo that very day telling us that the current government, this current administration has fed over 9 million children in public school. Not the secondary school, just the primary school. 9 million. And they have given out 1.2 million on the same nutritional status. My goodness. Then I look at the population of the whole country. I look at the one for the children. We have 24.5 million children enrolled in public elementary school in Nigeria. That is for the public school. The private school is 5.5 million children, making 27 million. Now, you are feeding only 9 million from 27. So this is what they need to do. And some parents are still saying that none of their children get this food. Publicly, people are listening to him. And we don't see the effect of what he was saying at all in our community.
Like I said, it is obvious that like what you have rightly pointed out, what our respected vice president was doing was not actually they were addressing they're using a clinical approach, which to address that's why I said it was a relief measure. It has nothing to do with the community or addressing nutritional needs of our population. What is important is that stakeholders would have been mobilized if they really want to address nutritional needs of Nigerians. We should be able to get stakeholders across, hold them together to be able to bring up recommendations on what to do, on what to assess, bring out guidelines. I've already mentioned the fact that in terms of food security or at homes, I've mentioned that it is important for us to assess what quantity of food that should be minimal in every home, what should be the component, the mix, and so forth. And then we should be able to also address the basic health services for maternal and child health in particular, because these are the most vulnerable group. So we should be able to have communities. Do we have primary healthcare services with the basic components of services to address women in their pregnant state and so forth, and children, and address their lactational needs. Then, of course, we should be able to have some basic assessment of women in their reproductive age, and then children under 5 in particular. These are most vulnerable. What kind of care? Care is not only about food. Care is about education. Care is about affordable housing and so forth. These are things that affect nutrition. So we must be able to have a complete, comprehensive assessment, and it is from the findings of the assessment that we can develop guidelines. And it is not something which the Vice President will achieve by feeding people, giving them lunch break, and so forth. That is not the approach. So exactly. I think there is need for us. Yeah.
Exactly. You're right. I'm going to refer to former Governor Fashola, Lagos State Governor Fashola. I remember when he was still in the government, in the office, and he did something that really amazed and impressed me personally. He did what I call follow-up. Every project approved by his administration, he must follow up to see that project is being executed. If you get given the money to do something, because what the VP was saying, I'm not sure they have follow-up. They just give people the money, and people that got the money, they just do whatever they like with the money and be giving the children rice, not even balanced diet. Because I was fortunate to see one school that served that food, and it's just rice. And if you see the plate they use for that, just rice and sauce. That's it. If they are able to follow up on that, they will achieve greatly. 9 million children. In fact, the money will be able to serve more than 9 million if they are able to follow up.
Yeah.
Because the main cause of food insecurity is poverty. We all know that. But I must tell you today that children and elderly people are impacted greatly by food insecurity and poor nutrition in our country today. And this group of people may be at higher risk for chronic diseases such as malnutrition, depression, like you mentioned, and more. I think the only solution to ending food insecurity is systemic changes. We need systemic changes in Nigeria today. The government needs to create a policy, like you rightly said, that we initiate supplemental nutrition assistance program and supplemental security income. We have it here. These are the programs that provide food and funds for shelter, for food to individuals with and without disability. The money is coming directly from the government. They're not using third party that will put the money and pocket it. No. And it has sequence. You have the number that will show that you are getting this thing. There is no magic in this. No one can defraud anybody. And this will continue. This food insecurity will continue, especially if we are unable to take care of insecurity in Nigeria. So thank you so much, Dr. Henry, for this extensive discussion on public health, food insecurity, and poor nutrition. We really appreciate you for this information shared today on the show. Thank you so much, sir. And I want to say God bless you for this initiative that you bring in. God bless you, sir. Have a good night, sir. Thank you. Bye-bye.
Thank you, Betty. Thank you. Thank you.
Bye-bye. All right, ladies and gentlemen, thank you for staying with us to the end of the show. You've been listening to Dr. Henry Anyuk, a public health physician, discussing food insecurity and poor nutrition as threats to people's health in our community. We urge Nigerian government to please put in place what we called systemic changes. Systemic changes among those living in poverty aims beyond providing food, clothing, shelter, and alleviating immediate needs. This change enables people themselves to engage in the identification of the root causes of their poverty and to create strategies, including advocacy, to change those structures which keep them in poverty. Systemic change requires transforming attitudes, innovation, experimentation, as well as constant learning and adaptation. And we hope our government can do something about it. Please do something. That's all we can share with you today on Healthy Living with Bufa Interview with Experts segment. Let's meet here next week, Sunday, where we bring you another edition on health and nutrition. I remain your host, Bufa, an integrative nutrition health specialist. Thank you for watching. Have a good night, everyone. Bye.